President Cyril Ramaphosa delivered his much-anticipated State of the Nation address. However, he didn't have much to say about healthcare. The president officially declared a state of disaster to deal with the country's energy crisis. And this means critical places such as hospitals may be exempt from power cuts. So to get some reaction now, I'm joined by the Health Systems Trust CEO, Dr. Themba Moeti. Dr. Moeti, thank you so much for your time and good morning to you. I mean, sure, Doc, I don't know about you. I didn't hear much about, the health sector and any plans the president had. Perhaps you did, but what's your reaction from the president's State of the Nation address?
Morning to Melo, and thank you for the opportunity, and morning to the listeners. Yes, I did listen, and well, initially I was struck by the fact that one of the first things that the president mentioned was to mention the COVID pandemic and its impact on health, the economy, livelihoods, and the devastating experience that it gave the country over the last 2.5 to 3 years, and the tragic loss of life with 103,000 lives lost and about 2 million jobs lost. And he correctly went on to speak about the energy crisis, because that is a major crisis affecting every sector, including health. Although, as you say, one would have liked to have heard more about the health sector in the president's State of the Nation address. The fact about hospitals going to be exempted and other health facilities, I think, is an important development, and we hope that will be able to be rolled out quickly. But in addition to that, you still need to make sure that facilities have the appropriate backup power systems, because power will fail for other reasons other than load shedding. And when that happens, those things need to be in place. And I think many facilities we've seen have been struggling over the past year or so.
Doctor, if I may just jump in there, I mean, do you think the national state of disaster could lead us to the right way in terms of mitigating the energy crisis and resolving it to avoid a total blackout?
Well, certainly if it speeds up processes by which government will be responding to the energy crisis, and the speed at which they can do that in terms of power generation and alternative sources of power such as solar being used by the communities, and hopefully this will then unleash and speed up the responses within the health sector itself in terms of making sure this plan to exempt hospitals does actually get implemented quickly, and that the necessary backup systems are in place. If it speeds up those processes, yes, that will certainly be a positive development. But I think at the same time, what one would have liked to have heard, we do know that we live in a very unequal country, and COVID, I think, definitely demonstrated the frailties of our health system, as it did the frailties of many. We saw what happened in developed countries with the huge devastation that they had. So I think in many respects, government did put up a good response to the COVID challenge. However, I think going forward, I would have liked to have heard a bit more mention about what's going to be happening to be done to address these huge disparities, because we know that the poor and those living under poverty were much more greatly impacted by COVID. I think there are statistics to actually show that, and so that needs to be addressed. I would have liked to have heard something about NHI and its implementation, because that's partly the government's strategy to try and address the huge inequality in the country. With the recent Stats General Household Survey of 2021, right, that showed that about 71% of the population access their services through the public sector. And we know that the public sector is under huge strain at the moment. There are significant human resources challenges, whether it's doctors, nurses, and so forth. And South Africa isn't necessarily, alone in that respect. That's a common factor.
All right.
But NHI and bringing in, expertise from, the private sector
Right.
was meant to be partly how we're going to alleviate this. So,
All right, Doc. We have to leave it there due to time. And
hope
unfortunately, I have to cut you off there. Apologies for being rude. But thank you so much, Dr. Themba Moeti, for joining us. Of course, the Health Systems Trust CEO giving us some reaction as to what he would have liked to have heard during the President State of the Nation address.